The next topic I want to talk about is oil pulling. It's something that patients ask me a lot about and where I stand on it. Oil pulling I actually love, but maybe not for the reasons that you've heard. So, oil pulling involves taking a certain type of oil, and it can be anything from a sesame oil to coconut oil, and swishing it in your mouth for a prolonged period of time. And sometimes that can be up to 2 minutes of swishing. And so, what's thought to be the action of oil pulling is that it's extracting organisms and toxins out of the gums and detoxifying the mouth. Um, I have personally seen oil pulling be more beneficial as a topical application for the gums. So, for instance, if there is a lot of inflammation going on in the gum tissue, I find that oil pulling is really beneficial for lowering that inflammation. So, I tell patients from that perspective, I think it's beneficial. If I have a patient who has, a raging infection on a tooth, I don't necessarily think that oil pulling is going to really be able to get down deep to where the source of that infection is and treat it that way. So I don't want patients to be misinformed that oil pulling is a problem solver for many areas of issues in the mouth. As opposed to more of a general kind of wellness for the gum tissue, especially for folks who have periodontal disease or gingivitis. So I'm definitely not against it. And if you want to do it even with healthy tissue there, I think there's no harm to it at all. I think it can only be beneficial for the mouth. Choosing the right type of oil, I think, is important. I personally like to use coconut oil or sesame oil, making sure that it is organic and sourced properly, I think is important as well if you're going to use it. But otherwise, I'm all game for oil pulling.